We do not have medical tourism going to India, and a lot of us go to India or South Africa or UK or the US, okay? But we need to have everything. We need our neighbors coming to Kenya. Let them come to even counties. So if county hospitals can be specialized, governor, you may have people from, from neighboring counties, neighboring countries, and regionally coming here. We say in the issue of trauma, for example, as a nation today, we do not have, 100 or 120 ICU beds in a population of over 40 million people. And today, if there were major disasters, then we will not have enough ICU beds. We'll have to take people out of this country. And it's costing taxpayers or the government a lot of money to do that. But if we had these facilities, they would come here. Based on going back to this current MoU we're signing today, again, there are very crucial areas. Food security. People believe Bomet is a rich county, and yes, it is rich in comparison to others. But if you look at the downside of the lower side of the lowlands of the county, there are people who are also food insecure. So this program is meant to make them food secure, so that security of a nation for me starts with the stomach. If you have your citizens secure, food-wise, Bwana Governor, the insecurity will decrease, yes, naturally. And this is again even as a bigger nation, So I think this step you are taking as a county to make your county food secure cannot be overemphasized. And I think this is the right way to go. And if there will be surplus, it will be sold even outside the county that other counties can buy from the farmers of your county. Not only tea that is famous for, but even the maize and other crops. But what we are going to grow in those lowlands will be something that can be consumed in the county, and what is surplus can be consumed outside the county. In terms of water, again, in this day and age, 50% of 60% of Kenyans are still drinking raw water in this country. So if we can give people clean water in that county, then again, when a governor, Daktari here will have 50% of his problem resolved because of health issues. If 50% clean water, magonjwa yanaenda by 50% chini. You can reduce your cost again of healthcare. Okay? So, and we can talk of all these things. In the area of disaster management, we are again very happy because you're the first county in this country that will now have a bill on disaster management. And thanks to yourself, to your county assembly, to the speaker who has been on the forefront of this issue, Bwana Korir, even if he's not here, we admire him, we like his way of working, and you can see there is leadership in that county at all levels, and that is why today whatever one wants to do and play politics, the ordinary citizen of that county understand what the county government has achieved, and that it speaks for itself. So again, you'll be the first one on that one. I know there are other counties we've been talking to on the issue of this one. We've been talking to Nairobi County, we've been talking to Nandi County, we've been talking to Boma County. Recently, we were called by the 22 counties in the arid and semi-arid parts of Kenya with the governor of Mandera, who is the chair, actually in this very room. We met them also, presented the same to them, together with the transitional authority. So again, Bomet is leading, and it's not by sheer luck or by accident. It is clear there is a vision, there is a strategy in this county, and that's why for me, I don't hide the fact to say that we as Kenya Red Cross actually like working with this county because things are straightforward, things are simple. And I'm not saying this because governor is here and you county executives are here, but you've been here for 3 days. You're here Sunday afternoon. How many counties executive will come to work on a Sunday afternoon to prepare for something? I mean, the civil servant mentality we had is gradually getting out of our system, and we're becoming more proactive, more business-like, and more private sector-like. And that's how we're going to grow our countries, because there'll be no devil on earth who will come and build Bomet County. It's only you, the citizens of that county, ni jukumu lenu kuhakikisha kwamba maendeleo yanaanza na nyinyi. And it's not just with the governor himself. Governor is a fatherly figure, he's the first citizen of that county, but he has given you authorities, given you powers to work and to think big, because sometimes it's better to dream. Tusiogope, and we work in that mentality as civil service tumekuwa nayo miaka mingi. Tuanze na mpya ambayo tunasema we are going to, the sky is the limit with what we can do. How would Bomet become the first county in everything? And that's what we need to challenge. Because if you go next door to your bigger brother, Kericho, they would say, you know, you are offspring of them. But it doesn't matter if you are offspring of them. Today you can be even ahead of them, ahead of any other, including Nairobi. Because statistics is what will decide at the end of the day. When you are tested, what you have achieved. I want that Minister of Health, Brother Macharia, to say, for me, Bomet is my #1 county in health. You know, so in every aspect of your work, especially in these 4 areas we chose, your challenge would be, we want to be the best in everything, not only within your own county, but countrywide in that way. So for me, we want to walk the talk with you. We want to walk this journey with yourselves, and where we can add and bring value, fine. We were just with the governor seeing the former Minister for Cooperative, Joe Nyaga, who was saying, look, now he wants to work on cooperative, how to revive cooperative movement and make them stronger. And I said the Governor Ruto would be here, so he met Isaac very quickly, and you know, he wants to work there. He wants to start anywhere where counties are ready, they want to work. Because today the private sector will only work where there will be success. They don't want to associate themselves with failures. And this is what we also want to see ourselves here. That's what we want to do with your good selves. And I can assure you, Bwana Governor, with my staff, we will work day and night, whatever we agree with, to ensure that we implement. My only plea would be, my sisters and brothers, the county executives, please see these guys as your colleagues. What you also want to do is, you have your own performance contract to achieve. If you want this governor to be happy with you, it's for you to say, I will achieve all my milestones and even exceed them. So I can go back to him and say, give me more resources to even do furthermore. This is what I say to my colleagues here. Every one of them is a fundraiser. Every one of them is a PR person. Every one of them is a technical person. We push ourselves to the limit on every aspect. When a disaster occurs, they'll be the first one to respond. Even yourselves, when we're now going to do further training, every one of you become the disaster prepared person. And then we will help you to also draft protocols for emergencies. When it occurs, is it only the governor, is it the minister in charge, or even the last employee of the county will be involved? Because it's for all of us. And I think when you become multifaceted, multi-purpose, it makes you a stronger person individually. And you then can say, I want to go to the next position and the next position and the next position. So I just want to say that I'm delighted on behalf of Kenya Red Cross. I want to thank you, men and women, who have put a lot of time in this thing. And I'm happy also, I'm aware that the governor coming on board yesterday even challenged all of us much more stronger, and that we've moved the envelope much bigger, to think bigger and to dream bigger. On our part, we will work very hard to meet on our side, and we'll work with you on the resource mobilization, because resources are out there. We have to work hard to go and get it, and convince those who are giving, why do they give to Bomet and not to anyone else? But we can assure you, Bwana Governor, we will be your goodwill ambassadors to talk for and on your behalf in the forums that we are going to be. But I also want to really congratulate you for the leadership you provided, not only to this county, but also to the Council of Governors and to the nation. And I want to plead with your good self to also use your position to bring down the temperature in this country, the political temperature, which has been very sad. As we sit here, there were those Kenyans killed in Peketoni. There were Kenyans over the weekend killed in Wajir and Mandera, senseless killing. There are those ones in East Pokot, you know, El Chamus, who even a chief is shot, and you know, his house has been burnt. And you wonder, where have law and order gone, and where have some of these things gone wrong, that today we can allow these things to happen with impunity. So I think you, in the political leadership, hopefully would help, using your good position, to bring the temperature down. This country needs to move, we need to develop, we don't need sideshows or distractions, and we hope for the best for our nation. But I just want to really say that we are delighted to welcome you today, delighted that we will sign this, and the challenge is now to move with zeal and with speed to start, you know, achieving. Because people want to see whatever we sign here should not just be on paper, but we want real action. So I would challenge my staff on my side so that they deliver. I would challenge the county executives, and really let us showcase this. Let us show it is actually possible, it can be done. So with those many remarks, nasema asanteni sana na Mungu awe nasi, lakini ni furaha tu kuwakaribisheni hapa leo na kusema ya kwamba sisi kama chama cha Msabo Mwekundu hapa nchini Kenya tunafurahia uhusiano wetu na kaunti ya Bomet, kwa sababu tunaamini ya kwamba kuna uongozi mwema na kuna uaminifu, na ya kwamba hii itakuwa ni mfano mwema kwa kaunti zingine kuweza kuiga na kuonyesha kwamba serikali haiwezi kufanya kazi peke yake. Serikali lazima ishirikiane na watu wengine, mashirika kama za kibinafsi au kama hata ni makampuni, ili kuweza kuwahudumia raia wetu katika kaunti yetu. Na nashukuru kwamba hizi miradi minne ya upande wa chakula, upande wa maji, upande wa afya na upande wa majanga, na kwamba leo tunaweka mkataba huu kidole kuhakikisha ya kwamba raia wa kaunti ya Bomet wanapasa kuhudumiwa vilivyo, na nyinyi kama kaunti na uongozi kupitia kwa gavana, mheshimiwa gavana, ya kwamba mko tayari kuhudumia watu wenu. Nasi tunasema tuko pamoja na nyinyi na tutahakikisha kwamba tunatekeleza mkataba huu kwa vile ilivyosemekana kwa hali na mali. Asanteni sana, Mungu aibariki.
That is health, water, agriculture and cooperatives. And we've also done a few other successful engagements with the Red Cross. Key among them is provision of ambulance services, which is doing very well, Secretary General, and we are really grateful. Our people are very happy about the services of the Red Cross team providing ambulance service. For once, you can now get ambulance without much ado. Previously, even if we were to buy the ambulances, you would find they have no fuel at critical times. You'll find the tires are flat. You'll find the batteries are not there. You find the driver is absent in danger. And in this case, your ambulance has arrived and the hospital has arrived. That is the key thing. The key thing is saving of lives. Not just having a vehicle painted ambulance. That does not help. It's the response. The response time is, as soon as it arrives, it has responded. Hours will take ages to get to hospitals. We are very grateful about the staff that you've trained under that scheme. And I'm happy to note that a number of counties have since copied that example, and we will continue to collaborate. Other than the areas that have been mentioned in health, which we are agreeing on today, there are a few other byproducts of our engagement which are now showing up and ready to yield fruits. That is on capacity building. That is also on provision of technical support, your support to our financial reporting systems, support to how to deal with implementation of projects, and further sharpen us on resource mobilization. Because as we are now, it's not easy for us to get enough money, or even money to reasonably meet expectations from both the allocation from national government and also our own resources on the ground. So we will need to sharpen our abilities to do resource mobilization, engage with other donors which are around, and this is just our engagement with the Red Cross will open doors to engage with other donors in a proper and structured way, and we are very grateful for that technical support. It will also help us identify other staff who can beef up our capacities. We are grateful for that, Secretary General. Other areas of disaster management, we will collaborate. We are coming up with a bill. Then you will also assist us to set up the requisite structures, build that capacity, be able to make us a model on response to disaster issues. And we believe that this engagement will definitely be for the benefit of not just the people of Bomet, the people of Kenya, and humankind across the world. Your ambulances do respond to humanity. It's not the borders, it's not just Bomet. If there is a problem anywhere they can reach, they have actually responded, including in Kericho to see now. Our hospitals have also quite improved. We now have dialysis machines working in Bomet. A few patients have now benefited from that. It's becoming now full beyond capacity. A hospital which when we took over had about 30-40 patients and hardly any activity, and there was even no water in the hospital. People used to come with water. You have to come with your own bucket of water. So if you didn't know that, you go borrow. You ask people in towns to bring you water to the hospital. Now we are full, and we now have, including consultants, we have got over 21, 22 doctors. We used to have 6, 7 there. Most of them were absent 90% of the time. And I was also delighted yesterday when I saw, when we were signing or discussing with the World Bank, we were shown a clip where even medical services in Samburu have actually improved. That means the healthcare sector has actually benefited from devolution. And in spite of the noise, in spite of the propaganda, healthcare is actually improving. In our county, that's the last part of it, our private clinics are now closing, and they're asking us to employ them. Asking to employ them because there is no more shortage of medicine in our facilities. We don't know where this shortage of drugs what used to cause it. Because the same people who used to supply KEMSA are the ones supplying us with the same drugs. And now our hospitals are full. We've built a store to have enough drug supply ahead by 3 months minimum. So therefore, devolution is indeed a wonderful thing for Kenyans. And this further collaboration with you will continue to improve our service provision. Thank you very much. Allow me to welcome
the first county Red Cross branch. We've also now gone the county ways. We'll have 47 county offices, we will have branches, we will have sub-branches, we'll also have regional offices. But the first county office that we established was Bomet County, and thanks to yourself, Bwana Governor, and the leadership of your county for having given us offices, converted it very quickly, and even a store where we could put some relief items. But you are okay, a second one to take the ambulances, but today I think it's quite clear, as you said, the ambulances have made a difference in the lives of ordinary wananchis of the county of Bomet. And we've seen, because of your own experience, we have now seen other counties coming over and taking ambulances, and thanks to your support and your county support, in fact your neighbors in Narok have also actually signed up to take theirs. I think the 9 should be here in July. They should have their 9 ambulances to start with. We have now Mandera that took also recently. In fact, they took 7 and they want another 7. And we are also finalizing with Kajiado, and there are many more coming. The bigger one is for NHIF. From 1st of July, we also have now signed up with NHIF for 222,000 civil servants and disciplined forces who will have a cover with 3 members of their families. So we're looking at reaching another 1 million people. But if we take Bomet, Kisii, Kakamega, Garissa, Mandera, we're talking of citizens of these counties which are close to 6 million. And plus this 1 million, already we're saying 7 or 8 million Kenyans that will be covered by E-Plus ambulances. But beyond that, we have ordinary membership that we also do with them. What we have seen is in the ambulances in most counties, Bomet, Kisii, Kakamega, and even Garissa, over 50% are maternal child health, or mothers who are delivering. And today, that this give women dignity to take them from their homes or from wherever to a facility where they can deliver in a proper facility, unlike before where they use wheelbarrows or use public means of transport to take them there. And I think today, when one wants to argue the issue of pros and cons for devolution, as an ordinary Kenyan sitting in this part of the city of Nairobi, I can say devolution was long overdue, and the result of devolution can be seen quite clearly that, you know, even a blind person can feel it. So even where this debate were to take place, Governor, I think, as you rightly said, there's been a lot of rhetoric that's been going on, but without wanting to be seen to take sides. But in this one, as an ordinary citizen, in my ordinary capacity, I can say, pity that it didn't happen 50 years ago. But there's always a first time to everything. It is now here. And I think the challenge is for all of you, especially those who are working in the counties, you, county executive, officers, and ordinary county workers, to show that actually this is there. Because those ambulances, if they were there 50 years ago, what would have happened? You know, how would have been the ordinary life? If drugs are in every hospital, then we don't need private hospitals, especially unless for luxury and those who want to go.
Fundraise jointly between Red Cross and the county government. We are delighted. We're happy to be seeing the end of that process that started, I think, 6 months ago.
Opportunity for us to visualize.
Yes. That's the annex. Same here.
This one, witness, and then they can exchange.
Just to say, here it is now. Governor.
A food security agreement. It is also security. You have if children don't sleep,
Yes.
they are not secure. They must first eat,
Yes.
and then they'll be deeply asleep.
Fresh to go to school the following morning.